Emergency medical technicians, EMTs, play a vital role in the fight against COVID-19. They transport patients to hospitals, and some are even providing coronavirus tests. I spoke with Matt Zavatsky. He's president of the National Association of Emergency Medical Technicians. And I asked him about how this pandemic is drastically changing duties and workflow for our EMTs. Has the EMS business changed as a result of coronavirus? Do you notice any differences?
Greta, it's almost the tale of two communities. So in areas that are hotspots, New York, Chicago, Detroit, Miami, those systems, healthcare system, including the EMS system, are stretched to the max. They are responding to 2 or 3 times the number of calls that they would normally respond to. The rest of the country, however, are seeing just the opposite. Because of stay-in-place orders and the reduction in medical procedures that are being done electively, our call volume for EMS across the country has dropped off very significantly. Here at MedStar in Fort Worth, between January and yesterday, we've seen an 18% reduction in 911 calls and a 31% reduction in the number of times that we're actually transporting someone to the hospital from one of those 911 calls.
I would think, just as a practical matter, is that with everybody staying home, this is good news. Is there less car accidents, which you all take good care of people? And if you have other symptoms like a chest pain or something else, or you think you might have coronavirus, you might be less inclined to want to go to a hospital, because we hear that you shouldn't go to a hospital, that the virus is so prevalent in so many hospitals. So I would expect that would have somewhat of a dampening effect on the numbers.
There are 2 primary reasons that we're hearing from our community about why the call volume is down, why the response volume is down. We'll start there. First, people are staying home. And as you exactly pointed out, when you're staying home, you're not crashing your car. You're not out at a bar at 2 o'clock in the morning and falling down and hurting your ankle or whatnot. So just people are being safer because they're staying home, and there are less things that can happen to you when you stay home. Secondly, people honestly are afraid to go to the hospital. So when they call, they know most of the time we're going to convince them to go to the hospital. They don't necessarily want to do that, so they're hesitant to call. The challenge with that clinically is that we are becoming increasingly concerned that people who should be calling 911 are not. And because of that, their conditions are getting much worse. We've seen a slight increase in our community here in Fort Worth in the number of cardiac arrests that we are responding to as compared to our total call volume. So we're beginning to do some of that analysis to see, is the delay in people calling 911 out of fear of the coronavirus actually causing worse patient outcomes?
All right, you're part of the National Association of Emergency Medical Technicians, which is hugely important to the nation that we have emergency care. But it's also hugely important that you all stay in business. What about the finances of the businesses? And is the stimulus bill going to help you, or is your business taken care of?
Ambulances only get paid if they transport someone to the hospital. So when we are doing things to prevent transports, to say to the person who may have coronavirus, hey, it's better for you to stay home, we'll give you some resources to contact. By not transporting that person to the hospital, we suffer a revenue loss. So we're trying to convince Congress and Medicare, hey, pay us for the treat and referral instead of taking them to the hospital, since that's really what we're designed to do.
Mr. Zavatsky says EMS units in the Fort Worth, Texas area have lost more than $6 million due to the coronavirus. He wants Congress to provide funding for EMS companies in the Phase 4 stimulus bill.